Today, I want to talk about a clinical condition called Bertolotti Syndrome. And I want to talk about it very briefly. This is a rather uncommon syndrome, but it is something that we commonly see in chiropractic clinics. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation and I'm fellowship trained in primary spine care. So Bertolotti Syndrome is a clinical condition that is characterized by, number one, the patient has symptoms, and number two, they have a genetic abnormality in their low back. So I have a model here and I'm going to show you very briefly. So this is the back side of the human low back. This right here is the pelvis. So this would be the left side. This would be the right side. This right here is the sacrum, otherwise known as the tailbone. And then here you have the lumbar spine. In adolescence and in childhood, the sacrum here is made up of individual segments, very similar to how the low back is made up of individual segments. However, through adolescence, this region starts to fuse and it becomes automatically one large segment. However, on occasion, the body will sometimes get confused and only partially fuse the top level. And you end up getting what is called a transitional segment. Sometimes with these transitional segments, these little protuberances right here are called transverse processes. These are where muscles attach. This transverse process over here can become rather large and it looks spatulated. This phrase that is used in radiology, and it looks like a spatula that you use to flip pancakes over. Well, that spatulated transverse process that's over here can start to rub against the sacrum right over here and against the ilium. That rubbing right there is not supposed to be there. And that vertebrae that should be nice and fused and create stable biomechanics in that area no longer does. That area can create localized pain, and sometimes that localized pain can radiate into the thigh or into the leg. It can mimic a disc herniation. It can mimic a pinched nerve. So the altered biomechanics, that is what a chiropractor can treat, as long as the chiropractor has the training, education, and experience and the equipment needed to do it. Very gentle chiropractic treatment can relieve the symptoms. However, patients with Bertolotti syndrome oftentimes will experience recurrence. So this sometimes is a condition that needs to be managed. So if you or anybody you know has ever been diagnosed with leg pain, has been diagnosed with no disc herniation that would explain it, you may want to have just simple x-rays taken to see if you have a transitional segment with a piece of bone sticking off to the side that is rubbing up against the sacrum. You truly might have Bertolotti syndrome. This is a very uncommon one in the general population, but within the patient population of people with back pain, leg pain, and no other real explanation found on imaging, this sometimes does get overlooked. Thank you so much for watching this video. You have a lot of videos to pick from, and I'm honored that you chose this one. I hope you found this helpful. Please forward this on to anybody you know that may benefit from it. And until we meet again, be blessed.